Beyeonics One is the next generation in the future of ophthalmic digital visualization. I was fortunate to be the first surgeon in the US to use this technology a little over a year ago, and also the first surgeon to acquire this technology more recently, and have now been using it for several months in our operating room in Largo, Florida. And we are enjoying it tremendously and having an incredible experience with the Beyeonics One headset visualization system. I'm very, very familiar with heads-up surgery using the Ingenuity system for many, many years now. So this is unusual because it's basically taking the whole concept of heads-up surgery and digital visualization to the next level by having this incredible headset with all these features, digital features, and focus and zoom and augmentation of the image and filters. We've even done some infrared cases where we've operated on and done cataract surgery without any visible light rays at all hitting the eye. And this is really quite the future of ophthalmology, and it's super exciting to be involved with it and be using the technology. The learning curve with Beyeonics One was really nothing. You put the headset on, you figure out the pedals and how to do, you use your head motion for zooming and for focusing, and off you go, just like you were operating either through a microscope or off a heads-up screen. The IR feature is very interesting. First of all, because there's no light on the eye, you don't have the patient squeezing or the Bell's reflex phenomenon of the eye rolling up in the back of the head. So the eye is more centered in your surgical field, and it's more comfortable for the patient, which puts everything at ease. Also, the tissues with the infrared, the resolution and the detail is highlighted tremendously, and the depth of field is more than we're used to seeing with visible light rays. So you can see the details and little tiny things on the capsule or inside the capsule that normally are not so obvious. So for subtle PSCs, or if there's a tear in the posterior capsule, identifying it, or doing a vitrectomy, trying to visualize the vitreous, all of these things are enhanced with the infrared technology. We know that light isn't great for the retina, and if the retina is compromised already from macular degeneration or other disease, we don't need that excessive high energy light hitting the retina. So if we can operate with infrared, less light, we can provide less toxicity to the retina, probably faster visual recovery. It's also easier on the surgeon's eyes because they don't have all that bright light through the microscope that they're seeing either, which is not good for our eyes and causes issues long-term as well. I would say that anybody who's interested in just kind of this whole new infrastructure of digital visualization and are interested in maybe getting themselves away from that uncomfortable position in a microscope, want to operate in a more comfortable, natural, be able to move their head around as they wish, want to add digital features and software into what they're doing, and just kind of have the latest state-of-the-art equipment for visualization, this would be the technology to take a look at. If I needed to summarize the Beyeonics One system into one sentence, I would say that it is a state-of-the-art, next generation and future of ophthalmic digital visualization for doing ophthalmic surgery with a system that any surgeon can operate in an extremely comfortable, super high resolution image system and really kind of take their surgery to the next level.